Thank you. So I'm Betty Keller, of the President of the Vermont Physicians for National Health Program, and happy to have Gillian Mason, Executive Director for Healthcare Now, with us today, the Northern New England Summer PNHP, as Physicians for National Health Program Summer Internship, to talk about leadership. The interns have already viewed a recording of a previous presentation that Gillian has given to our interns, and she knows where you guys are kind of and what you might be needing from her previous experience. And we're hoping to roll right into a good discussion now. And we'll be sharing this with the interns from Rowan who had to leave us this week because their classes started last Monday. So, so thank you so much for being with us, Gillian, today. And I'm wondering if you could just start with talking a little bit about Healthcare Now and the resources you can offer to organizations.
Absolutely. So what we're doing right now is actually my favorite part of what Healthcare Now does. So I'll say Healthcare Now is a national organization. We were founded 20 years ago in order to pursue the idea of Medicare for all, universal healthcare, whatever you want to call it, right? A system where everybody's in and nobody's out. So that really started with like activists from the civil rights movement who came together and felt like this was like the undone work of Dr. King and the rest of the civil rights movement. And that I take that charge really to heart when we do our work. So as Betty was saying, we have affiliate organizations that we work with on the ground. A national organization can only do so much, right? Because really all of the organizing happens on the ground, individual relationships between people, right? And so what we try to do is to offer support for folks on the ground who are doing that kind of organizing. And so we support people who are working on the national single payer bill, the act that's in Congress right now, sponsored by Pramila Jayapal and Bernie Sanders. We support folks who are working on statewide single payer bills, right? So like in Massachusetts, for example, they are, there's Mass Care, they're a statewide organization, and they're trying to create a statewide single payer system in Massachusetts. And then we also support people who are doing other things like just defending the public health systems that we have. And frankly, over the past 6 months, we've been doing a lot of that work, right? Trying to get involved with the fights on Medicare and Medicaid. And, it's a moment when if you're a person who cares about healthcare justice, right, we need to be working to try to defend what we have and also move things forward. So that's kind of our ideological position, right? We're committed to doing this through grassroots organizing and creating social movements. And so in order to accomplish that, I would say we have 3 kind of ongoing projects. One is that we have a podcast. It's the Medicare for All podcast. If you haven't listened to it, I strongly recommend it. And that's not just because I'm the host, but it is like the funniest non-comedy healthcare podcast in existence, really. And so we totally recommend that. It's kind of our way of like, afflicting the comfortable and comforting the afflicted. I don't know if you've heard that term before, but so provide a lot of like kind of education to the public with that. We also do trainings, which is a really important part of our work, like the training that you saw me give in that video. We have a, kind of an 8-session comprehensive training series that goes through everything that an ordinary activist needs, from understanding health policy and being able to kind of like break down some of the myths about our healthcare system, understanding things like the way that racial justice and reproductive justice fit into healthcare policy, and then also just organizing skills like the ones that y'all are learning through this internship, right? Leadership development, making sure that you have a healthy, organization organizational structure so that you can keep going and not get bogged down by shitty interpersonal stuff, right? All of that stuff is kind of covered in our training series. So we offer that to activists all over the country, both ones that are connected to a group already and folks who'd like to be connected to a group who we can connect, make sure that they get to meet people in their area so that they can do some on the ground organizing. And then our final kind of big project that we work on is something called Voices of U.S. Healthcare, and that's a national database of healthcare stories. Our organizing is very much story forward. We've seen all of the latest data, right, that shows that data doesn't really persuade people very well. And so, we know from both from anecdotal experience in different kinds of social justice movements, and then also, based on like kind of like the most recent actual studies on, so the sociology of human behavior, we know that that it's really important for people to hear stories from impacted folks so that they can learn to empathize and build those kind of pathways that make them want to take action. So we have this national database, and it's basically stories from impacted people, who have had some kind of problems with the healthcare system. I think we have over 100 there now. Again, from all over the country. You can search based on, the state that you're in, whether you're not the person who's willing to speak to a reporter or go to an action. You can search based on the health conditions people are working on. So this is something that you'll, I hope, take advantage of in your organizing. Collecting stories and also sharing stories is key to the work that we do, and we kind of use our tools to help people to do that. So that's kind of the big stuff. We also work with the National Medicare for All Coalition, and we help folks to sort of plug into that coalition. Get little local organizations to endorse the Medicare for All bill, et cetera, and kind of mobilize people when there are key moments like when the bill has been reintroduced and we need to collect sponsors and the whatnot. So. We do all of that. And I am our staff member. I am our single staff. So we rely heavily on volunteers to do it. And so a lot of the folks who are volunteers in our network are folks like you who are medical students or who, will go on to be doctors. So hope that at some point y'all can be part of that kind of giving back to the future of the movement. So that's what we do. We do a lot of nurturing, grassroots organizing, and providing resources for folks so that you don't have to reinvent the wheel. Is that a good? I think that's it. I'm sorry, I was probably speaking for way too long.
Do you still participate in the town resolutions effort, or is that not really going on right now? Public Citizen was sort of spearheading that, I think.
Oh yeah, no, we definitely do. We support Brittany Shanahan is the person who's sort of the helm of that campaign, and we definitely we support her work in doing that. She's right now doing some really interesting work in Maryland, trying to build power there. So it's really good stuff.
So you still do connect people between states? Like if somebody said, I'm from Arkansas, can you help me connect with other people in Arkansas? You still do that?
Yeah, absolutely. Okay. Absolutely.
And if somebody were trying to start up a new, grassroots organization in Oklahoma or something, would you be able to help them with like databases and like how do they start collecting email address and stuff, or what do you do?
Yeah, absolutely. I mean, we start out by trying to introduce them to people in our network, right, and trying to build a database. And we actually we did this a couple years back with folks from Puerto Rico who were interested in starting a Healthcare Now Puerto Rico chapter. And so we do a lot of introductions, making sure that they know the right people, and then we do a lot of trainings on things like how do you take a small committee, right, and grow it into a large one. And it's really the same tactics that like labor organizers and community organizers have used throughout time immemorial.
Thank you. What questions do folks have that were either inspired by the video or that you've just in general had this question about like leadership and how do you grow an organization and all?
Yeah, by the way, while you're thinking about that, I did drop the links to, I wasn't quite sure exactly which ladder of engagement we were talking about, but I dropped the links to two different presentations that might be useful to you while you're thinking about leadership development.
So we have the healthy campaign, I think, although I'm not sure it was called Healthy Campaign Culture and Structure. But so thank you. I'll take a look at that and see how it differs from what we have from before.
Cool.
And it's a leadership development one that I was talking about. Yeah, so it's like slide 6 of the second one that's in that chat.
You know, I was actually thinking a lot about what Inanna said about having a hard time finding mentors, right? And I wondered, you know, I thought that was a really interesting point because I started out in academia. Actually, I got my PhD from BU. Go Terriers. And yeah, so I found in that environment, right, a very similar kind of reluctance, right? People were very caught up in their own work. They didn't really see mentorship as like part of the job. And so I was thinking that one of the interesting things that you're in a position to do is to start thinking about how you change the parameters of the job once you get there, right? To be able to extend mentorship to other people.
Yeah, I didn't really have a mentor in medical school. A pediatrician that I was doing a rotation with in clinical core looked like he was inviting that kind of a relationship, but when he found I was going to family practice, it was like dropped like a dead balloon. Zachary?
Um, I'm interested in hearing what you think are like the most effective talking points at getting people interested in healthcare advocacy or healthcare reform, especially for those of us who are trying to start like a SNAP chapter on our campus, from nothing. Um,
Yeah.
I don't want to, I just want to know what the messaging should be, just so I'm not alienating people or making it seem too intimidating.
Oh, that's really interesting. What say more? Say a little bit more about what you're kind of how you're afraid you might alienate people, or what's the fear? Yeah.
Yeah. Well, I think even for me, sometimes the healthcare system between like pharmaceuticals, health insurance, defending Medicaid, it can get like there's too much. I don't even know where to start. What can I even do? Like these are the most powerful lobbying corporations in the United States. Is it even worth it? Right. So that's where I would
Yeah.
get the feelings of being overwhelmed, and I would want it to be more approachable, like, but I don't know if other people think that. So that's what I was referencing specifically, though.
No, I think that you're absolutely right. I think that when people approach a bureaucratic system, especially one as huge as the healthcare system with so many moving parts, that they do tend to be intimidated. So, one of the ways to kind of do to sort of talk about healthcare policy without talking about healthcare policy, which I would strongly recommend, is to talk about outcomes, right? So to talk about people who are encountering the healthcare system and what they're actually experiencing, right? So sharing stories of your peers and that kind of thing, who are being impacted by the system, and that way, again, you like immediately get people's empathy going, right? And you don't get bogged down in the intellectual piece of what does the system look like, what is policy, what is that kind of thing. So I think that that's one thing. And then the other thing is to like keep on emphasizing the fact that this system is complicated in order to fuck us over. Pardon my language from New Jersey. Um, uh, this system is complicated deliberately, right? So that we can, we have a harder time figuring out how we can take action. So, I guess sometimes people, we have this like kind of bootstraps culture, right? Where like people assume that if they don't understand something, that it's their fault, right? So I think like reassuring people that like, no, it's not you, right? This is designed to be complicated and it's designed that way specifically to deter you from taking action or deter for you from trying to get involved. So, you kind of frame getting educated about healthcare systems as like kind of, itself a revolutionary act. So I think that that's one way. Yeah, but really digging down into people's human experiences is the best way to avoid that kind of overwhelm, I think. Yeah.
I think that today, things are made needlessly more complex purposely, but I think that initially it was really more a matter of healthcare doesn't fit in the free market system. So then you create a regulation to try to fix that, and that regulation
Yeah.
to fix that, and somebody fixes another loophole, so you create another so it became incredibly complex, not necessarily purposefully. And so if you're with somebody who's gonna be predisposed to think that you're wrong because he already's been told, or he or she's already been told that single payer can't work in America and it doesn't work, and you need to have the competition, the free market system, everything. If they're predisposed to think that, then they will pick apart little details that may not be perfect. And if you say is purposely complex, then they could nitpick at that and go back to like, well, originally it's just because it, you've regulated it so much, So you want to kind of also figure out who your audience is and what their arguments are going to be. Natalia?
Yeah, so my question had to do with I think everything that you described about the leadership ladder and everything makes sense to me. So I kind of wanted to tailor it more to our situations because at least for me as a med student at Drexel, our leadership teams, we show up M1, we learn about the organizations. M2, we become like presidents, co-presidents, we lead the team. And by that February, we're out. So, and then we're also very busy the whole time. So I'm just wondering, given such an unstable leadership structure and limited time, how can we keep our chapters as productive as possible?
Yeah, that's a really, really good question, right? And I think that that's something that a lot of folks who are not working in a kind of university or school context, I think they fail to understand just how quick everything happens, right? Just that cycle is like always happening. So I think there are two things with that, right? One is that you have to make sure that the cycle is always happening, right? So even while you're developing your own leadership, you got to be pulling other people up behind you, right? So that's really more of just like a kind of attitude adjustment, that like part of our work is not just getting things done, it's getting people trained, right? So that's one. But I think the more practical thing that has worked with the students groups that I've worked with in the past is that you really need to work on a culture of documentation. I think that that is the most important thing in order to create kind of seamless transitions between leadership. So, for example, in Healthcare Now, we have like literally have a guide to being the executive director of Healthcare Now that lists out all the things that I have to do, right? I have a guide for every single volunteer role we have, right? Whether someone's writing notes on our podcast or doing, entering stories into the database or whatever, right? So taking that like extra time to document everything is really, really crucial, I think, for you guys. So create a Google folder, or I'm sure you have better technology than Google, or maybe not. But I tend to think of medical school as being really fancy. So yeah, constantly documenting, constantly being creating guides, and constantly updating those guides, I think is like absolutely imperative. Yeah, yeah. Does that answer your question?
So
I
another
mean, it's not an easy
comment
answer.
on that actually too is that so to be a club on the campus and get your money from whatever it is, student services or whatever, student activities fees, you need to have a faculty advisor. And Rowan is extremely lucky that they have faculty who are advocating for them and will be the advisors and help with those transitions.
Mm.
Many schools will not find that because the physicians are employed and are concerned about their employment. So you'd have to hunt around to see if you can find the physicians who will, or if it's in a university, you might be able to find somebody from the economics department or something. And I don't know, you have to check with your school. Does it have to be a medical school faculty or can it be someone else? And if it has to be medical school faculty, would a PhD in a different department like cell biology that has, maybe they would be more willing. So thinking about, trying, even if you have a faculty advisor for this year, they may be too busy next year, they may move to a different job or whatever. If you can try to like build up a little cadre of people to hand off, again, in that documentation, people know who to ask next if they don't have one. And the other is, if you're not tied to having to have it be a school authenticated or whatever one, PNHP doesn't require it be a faculty member. It could be a PNHP member out in the community. It could be somebody who's retired, not worried about their employment. It could be somebody who's not a physician. I don't know whether you've met Barbara Pearson or Judy Esterquest from Long Island, but those might be people that Stony Brook might want to look at if you're having troubles finding long-term mentors. So, I mean, faculty advisors or other advisors. So, so trying to figure out that piece could be really helpful. And like at UVM, we have a gentleman who, bless his heart, he's doing research, supervising residents, seeing patients, and raising a family. And so he's like, I can't hold your hand. You can put my name on the paper, but then you got to take it from there. And, never comes to the meetings. He'll answer a question if you email him. He's very fast at answering emails, but he's not going to remind you that to be a club again next year, you have to fill out this paperwork in April. And if you have a table in August, you have to fill out this paperwork in the spring, So the first years have to be handing off that information. I mean, the second years have to be handing that information off to the first years. And if you're already gone in February of your second year, you had to like let them know before you left, right? So that documentation is really critical, and making sure that, several people are on that to access it, including some of the faculty or other PNHP members, if, so that somebody can access it if your club does take a hiatus because there wasn't leadership right then. I don't know if that's helpful to any of you. But a good question, because it is really hard for those who leave midway in their second year and they're like disappearing for a bit.
I mean, and also just like, I mean, I've just watched people in medical school, start out really enthusiastic about doing organizing and then just like get sucked into medical school, right? Which, I don't know, from the outside seems very challenging.
It is hard.
And like a lot of work. So you want to kind of factor that into the people who start out being really enthusiastic might not be able to be full on involved through all the way throughout their education. You want people to be able to kind of dip in and out.
How many of you are in a school that's associated with a university that has undergraduates at it too, not just a medical school standalone? So students for National Health Program don't have to be medical students. And I have not seen this successfully continue. Yeah, the only place that UVM actually had undergraduates who reached out to PNHP and said, can we form a SNaHP chapter? There isn't one here right now. They didn't know that we had interns at the same time who were doing the internship in the summertime, right? So they asked to do it in the fall, and the school gave permission. And then when our interns went to do the paperwork, they was like, oh, that's duplicative, so you can't start one. It's like, what? We're the medical students here in this place, and we know that nobody else but us is doing it. And then they didn't even know about the undergraduates existing until I told them. And if a team could work together, if you could figure out together a time that made sense, then having that group of people who have less work on their laps and have 4 years instead of 2 could be a huge a huge benefit to the SNaHP chapter's sustainability. But there's also this issue. Well, one of these 2 interns who took it that year also said, oh my gosh, I'm 32. I can't deal with undergrads. I just can't do it. So they still didn't combine. And if you can get over that, if it could be like having multiple faculty advisors and anybody, whether it was MPHs or MD candidates or undergraduates, if you could all work together, because you're all starting at basically the same level, unless you have a physician who's been active in PNHP for a while, right? But if you could figure out how to work together and meet each other's needs and make sure that like we could probably work with Healthcare Now or somebody who gives some training to the faculty so they didn't take over the leadership and you guys didn't get to do what made sense, you know? So we want to be watching out for that and not have it just be a PNHP chapter that all the students stop going to, right? But it could be a model that might work. And at UVM, this happened in 2020. So here we are heading right into the pandemic and all the meetings were suddenly hybrid and suddenly the undergraduate lasted for just that 1 year. It started in the fall of 19 and then it fell apart by like December of 20 or something like that. So I'm not aware of it having a longer life anywhere else, but I would love to see that model tried and see if we could tweak it in ways to make it work for places.
I mean, another way to make your organizing more sustainable is to think about it not just in terms of like building your own organization, but also like coalition building. So, you know, thinking about other groups on campus you might want to engage. And, you know, people like, you know, you might have like a Black Lives Matter group on campus, right? Now, obviously, like, you know, Medicare for all is like a big component of racial justice in healthcare. You know, you might want to approach them, say, hey, look, is this something that you just like to endorse? You know, is this something that you'd like to be actively involved in organizing? Or maybe this is just something that you would notify your members about when we are doing something or have some kind of action to take, right? And that way you're kind of incorporating a broader range of people, and that helps to take some of the pressure off of you know, y'all basically.
Do you have thoughts to share about coalition building as far as like not even just on the campus? I know that the SNaHP chapter in New Orleans at LSU kind of got going after having a few of the individuals collaborate with folks who were trying to get that town resolution going. And so that most of their work was off campus and they were making connections, and then they started a SNaHP chapter up. Can you talk a little bit about coalition building?
Yeah, absolutely. Yeah. So when you think about coalition building, you want to think, I mean, I think, you know, when you're building student organizing, you want to think about students first, right? So definitely the groups that you have are active on campus, that's great. Even individual students that are active on campus, so or people who are in leadership you know, positions right now. They might not have time to fully devote to your organization, but having them involved can be really useful when you deal with campus politics, right? And so, but in terms of thinking about like the broader community, people love working with students in general. I've seen this happen before, that student groups have gotten involved with those local resolution campaigns. They're very kind of manageable in general. You know, I mean, they've managed to pass these local resolutions in Denton, Texas, right? Or in different places in Florida, right? So, you know, it's like,
you guys know what we're talking about, the town resolutions? Do you know what that, have you heard about that? So,
oh, yeah, okay, so back up real quick. Yeah, so the idea is that, like, you know, if you live in a place where like, for example, I am in South Texas right now, and so the idea that we are going to pass single payer healthcare in Texas is frankly laughable, right? Like, it's just not something that we're at the point where we could do. So what do we have to do? We have to build power in Texas, and the best way to do that is at the local level. So you can go in and have, you know, different municipalities, cities, towns, make you know, have their city councilor do try to pass a resolution that says this, you know, this city or town, you know, the people of this city or town are for a single payer system and would like the legislature to take action. It's the kind of thing where, like, if you do that in a first of all, it can be influential in moving particularly like state level legislators, you know. If the big city in someone's district, right, is talking about single payer, then all of a sudden that's something that they might have to deal with, at least, you know. And so yeah, it's a good way to kind of like get the issue in the air, get people talking about it, get people involved, and yeah, it's like a much lower lift than trying to being like, hey, come and get involved and let's try to pass national legislation in an unhospitable political environment, right? So yeah, those state resolution, those municipal resolutions could be really good, manageable campaigns.
Yeah, sorry for interrupting. I just thought we should let them know what we're talking about.
Yeah, no, absolutely. Right now, let me see if I can actually call this up. Like right now, I'm working a lot with the nurses union and with the national coalition on trying to engage local organizations in the national work, in terms of like, you know, just like getting them to support the bill and just like kind of bringing them into our universe, right? But the way that we're kind of pitching it is we're in solidarity with you with the work that you're doing now that is maybe not related to healthcare, right? So we'll mobilize our people for fights on Medicaid, or for, you know, we'll show up for racial justice. We'll show up for justice in Palestine or whatever. But we're, you know, we're just gonna keep Medicare for all as our kind of North Star, right? We want to keep the vision of Medicare for all alive, and so that's been really useful in building out our coalition. We have a little toolkit that says like how to bring single payer everywhere you go, so that our activists can actually be agitating in their own organizations for that kind of support.
So who is in the National Coalition for Medicare for All? I just did a quick Google search and says there's not a single organization actually called that. So who is the
Yeah,
coalition?
sorry, our website is not up yet. But it's a bunch of different national organizations. So it's like the Nurses Union, Healthcare Now, the Labor Campaign for Single Payer. We do a lot of work with People's Action, with what used to be the Center for Popular Democracy, now just called Popular Democracy. They streamlined. And a million that I am now forgetting. But
Is the League
yeah,
of Women Voters in that list?
I don't think so, not right now, but we do work locally with a lot of League of Women Voters chapters. Yeah.
Right. And so when the League of Women Voters Healthcare Reform Committee tried to persuade LWVOS to sign on to something, I don't remember if it was against the DCEs or specifically for letting people advocate for the Medicare for All bill with the LWV name, you know, and they said, well, let us know who else is doing it. Like, we want to know who's in the coalition. And like, I couldn't figure it out. I couldn't find something that said who was.
Yeah. Yeah, we realized that like, you know, we've been working on kind of building this group for a few years now, and we were like, yeah, it's time now to have a web presence and to you know, to be doing some more outreach to other organizations.
Yeah.
So yes, hopefully that website is going to go up any minute now.
Thank you. So I'm wondering how many of you have been in a one-on-one, and how many of you have been the one who did a one-on-one with a new advocate?
Oh, y'all, the one-on-one is magic. That is your magic.
So I'm waiting for one of you, because I
sauce.
know that you have.
Been in one or done one?
Been in one, that somebody else did a one-on-one to figure out where you were.
Yeah, I've spoken with Lori Clark from PNHP.
Oh, she's great. Love her.
Yeah.
I have as well. She's awesome.
So I will share with you that when I saw that, I realized that I had been doing one-on-ones with every applicant since I have been doing this. I didn't know it had a name, and I didn't, and so I didn't say, I'm going to do a one-on-one with you. I'm like, I'm interviewing you for this internship, but I have said, set aside an hour for it. And I've been trying to figure out if this isn't a good fit for you, where it might be a good fit. What other resources can I share with you? So I have been basically doing one-on-ones for every applicant that I give an interview to.
Yeah.
So you've all been in a one-on-one.
Obviously it'll be slightly different when you start doing the one-on-ones with your peers, right? So like with like other college students, right? People who aren't already bought in, right, to the cause or whatever. But I think you'll find that that's kind of liberating too. You get to do a lot of listening. Yeah. By the way, I should have said Physicians for a National Health Program is part of that national coalition I was talking about earlier.
Oh, I was sure of that one. Yeah.
You forget the things that are right in front of your face. Yeah.
Yeah. No, they may not have known. I knew that. Yeah.
Mhm.
Okay. So thank you so much for your time. I am
Well,
sure that Gillian would be welcoming any further questions if
I
you.
absolutely would. And I did have one thing that I wanted to tell folks about.
Yep.
One of the things that we do at Healthcare Now is we organize an annual, it's like the annual national gathering of single payer activists. It's our national single payer strategy conference. And this year we're going to be doing it in person in Central Florida in November. So November 22nd and 23rd. That is not even up on the website yet. So that's a little sneak peek. So one of the things you might think about doing with your groups is seeing whether you could organize a little delegation to come to the conference. It's a leadership building opportunity, great team building opportunity. You know, you all go to a conference together, you learn different things, you like, you know, whatever, go out for drinks afterwards or whatever. So it could be a really good cadre building experience also. But anyway, so I hope that you'll join us in Florida. And honestly, don't you want to be in a warmer climate in November, right?
So I'm not seeing on my calendar, which is Thanksgiving. Is that the weekend before or after?
Correct, before.
Before. Okay.
Yeah.
Okay. And so you said that you do support state-based single payer. Are you participating in the efforts to get more co-signers on that state-based universal healthcare bill?
Yeah, I got to get in on that. I've been and a lot of the members of the National Coalition, we've been really, really engaged in this Medicaid stuff. It's just such a crisis and it's so essential, right? And so I think that the introduction of the state-based single payer bill sort of snuck up on me, I have to say. But so yeah, so I do have to definitely engage our folks more in the co-sponsor drive. But yeah, we're supportive of it. We love it, and we'll feature a lot of people from one payer states in our conference as well, which we love to do. I would say that probably like 75% of the state-based organizations are working on some kind of state-based universal healthcare system, whether they're just doing research or whether they're further along in the process.
I'm sorry, what did you say that 75%?
Of like our local affiliates, right? So like the groups in, you know, New York and Chicago and whatever, that they're most of them are working on some kind of state-based single payer system, right? Whether they're doing research for that or trying to pass a study bill, right? Which is basically pass a bill saying that Congress has to study, you know, how much it would cost or whatever to create the system, or whether they're further along in the process. Like CalCare is a really good example of, you know, folks who are really deep into the process of trying to establish a single payer system. So yeah, a lot of folks are working on that, and we are supportive of it because frankly, you know, let a thousand flowers bloom. We need a diversity of tactics in this fight.
Yeah. And then about a quarter of the states are just focusing. I mean, if you're in a state where you know it would never pass, then you're probably not going to put a lot of time into it.
Yeah, I think that's true. I think that's true.
There are other
In some ways,
organizing
that's the states where it's most necessary. I'm really excited that we're actually going down to Florida for the conference because I really
Yeah.
want to put the spotlight on folks in the South, in particular, who are just really fighting these red states and doing a great job of it. It's really cool.
Great. Well, thank you so much. Any other questions before Gillian leaves? Okay, great.
Oh, sorry. I'm just
No.
going to leave my email address in the chat.
Great.
Please think of me as a resource and feel free to email me. I'll put my phone number here too if you want to ever text me. I do a lot of things like toolkits, for example. So like if, plug and play, if you wanted to get your group involved in doing co-sponsor drive or something like that, I can send you a full digital toolkit that you could share with your folks or whatever. Again, like don't bother reinventing the wheel, reach out first, and I can guarantee you that someone else has already created a good system.
Great. Great. Well, thank you so much.
Cool. No, thank you. Appreciate it. And love y'all, love your program, and just really excited to be in movement with you guys in the future.